So I've been a nurse for a long time, for over 20 years, the majority of my time in critical care, and then on the rapid response team at, at OSU. So I respond to patient emergencies on the floor. Um, we respond to the emergency department for traumas and different emergencies. Um, and so what we've seen over time, really my entire career, um, I've seen violence in the workplace, violence towards healthcare workers. A really disturbing thing that like pregnant nurses being targeted. You would think that that would be a time where somebody would show some respect, and that somebody is in there carrying a baby and working. But oftentimes those nurses are targeted for violence for different reasons, and so it's really disturbing. It's been an issue before the pandemic, but it has definitely ramped up after COVID. And a lot of the political division and nonsense that occurs is ramping it up. And so we see elected officials pushing conspiracy theories, undermining science. And so when that happens, when people come into medical institutions, they don't trust us. They don't trust the science. They don't trust us as professionals, and so that erupts oftentimes in violence when you're trying to talk to somebody to let them know what's going on, that a certain treatment is needed, or in an emergency, um, it 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 spills over and it erupts, and people, um, screaming, yelling, hitting, punching, throwing things. A lot of times it's visitors that are engaging in the workplace violence. Sometimes it's patients as well.
How does that make you feel?
It's really disturbing. You go into that space to care for patients. You know that their families are under stress. You know that they're worried, and so you come at those situations from a very compassionate perspective, and then to be met with violence. We're there to care for people, so we're not equipped to fight back. We're not in a mindset to fight back, and so you're there providing care to a patient, and then you get kicked in the face, you get elbowed, bit, whatever it is, um, in that space where you're trying to provide care for somebody. You're trying to um, give them their medication, or provide wound care, or even giving them pain medication, or it it doesn't it's not always like somebody like having a reaction to having an IV started or something uncomfortable. Sometimes it just comes out of nowhere.
What can be done about it?
So understaffing is a major issue in our hospitals, in all hospitals, it seems. And so when we're not able to meet patient care demands, frustrations mount. We're not able to de-escalate situations like we need to when we don't have staffing, and not just clinical staffing, not just nurses and respiratory therapists and doctors, um, but security personnel on the floor. So when you know somebody's a violent patient, you should have security resources at arm's length. They should be available to respond immediately. We shouldn't have to go in and get beat on time and time again. We should have resources available to keep people safe. Hospitals should also have personal protective equipment. And when we think about PPE, we often think about gloves, face shields, gowns, different things like that. But there's personal protective equipment that's available when you are dealing with patients. If you have somebody that you know is going to scratch or pinch, there are rubber sleeves that you can put on. There are Kevlar gloves to prevent bites. And so hospitals need to have that kind of equipment for us in specialty situations when we need that equipment. We need security personnel. We need security screenings when people are coming into the hospital. Um, we need people to know there's a zero tolerance, so we need hospital administration to administer and enforce those policies even-handedly. There shouldn't be exceptions for VIP patients. So just because you're friends with the medical director, you shouldn't get to come into the hospital and make threats and scream at us and then call your buddy and get back into the hospital. Um, there should be no VIP in healthcare because every patient, when you're a nurse, every patient in that bed, it doesn't matter if they're a homeless person or a millionaire, they're the same in our eyes. They're a person in that bed that we're responsible for. And so we need hospitals to treat patients the same way.
Have the hospitals been a working partner with you to make the situation better, or are they resisting the changes that you're calling for?
So we see different levels of collaboration at different hospitals. So some hospitals have worked with us. So following the shooting at Altman main campus, we represent the nurses at Altman Alliance, and so we submitted a demand to bargain and worked with management, and we just recently came to an agreement on a number of protections for um, the nurses that are covered by that contract at Altman Alliance. Um, the hospitals agreed to put up signage, zero tolerance of workplace violence. They're working on weapons detection systems at the main entrances. Um,
What about the Wexner?
Wexner Medical Center, they have agreed after, we had to escalate that. We were seeing guns coming into our hospital undetected. There was a situation where a patient came in through the EMS entrance for a different reason, went to the waiting area, and because of the extended boarding times and bed availability issues, that patient waited a long time in the emergency department. Their the situation escalated. The patient was making threats, making eye contact with a nurse, saying their name, reading their name off the badge, and saying, "I'm going to kill you." After that situation was handled, they had to bring security out, put that patient in restraints out there in the crowded waiting room in front of everybody, got him back to a room, and when they searched the patient, they found a loaded gun and a clip. And so it's one thing to have somebody make death threats against you and to make those, verbal aggressions. It's a whole different level and hits way different when that person had means to do it. And so that could have easily turned into a deadly situation, and that patient would have been shooting fish in a barrel. There would have been nowhere for people to escape, to seek cover, and it would have jeopardized everybody in that waiting room, in that department. And so even with that situation and bringing that to them and asking for change, they didn't do it until we exposed them publicly. And it was multiple escalations, multiple demands, and then they finally agreed to do the weapons detection systems at the main entrances. We had to file a complaint with the state, with the Public Employee Risk Reduction Program. That state agency came in and issued a hazard letter and told OSU Wexner that they were not doing enough to keep employees safe, and that they needed to have security measures at the EMS entrance, and to also follow up on their plan and make sure that it was actually working. So it used to be like when I first started in healthcare, if there was a safety issue and you brought it forward and made the case that it was a safety issue, it got the attention that it needed. Things were followed up on. Now, and especially following COVID, it seems to fall on deaf ears. Like seeing guns coming into our hospitals and death threats being made, and that not be enough to make you move as an executive. Like how do you turn a blind eye to that? It's really hard to go in and work for a system when you know that they have that knowledge, that they have all of the information. They have the incident reports, they have all the background information and could do better. They're in a situation to authorize the changes that we need today and they're choosing to do something different. And that is completely unacceptable. And that makes it really, really hard to go to work and know that you could die at work so that somebody can sit in their little privileged cocoon in an executive suite and make millions of dollars a year off of your labor and not even give a damn enough to put a policy in place to hire enough security personnel to make sure that you can go home to your family at the end of your shift and not get shot in the face at work. I don't think that's too much to ask.